What is Disease X and why should we be vigilant about it? According to the most recent guidelines by the World Health Organization, or WHO, Disease X denotes an unidentified pathogen that could potentially trigger an ensuing pandemic. Not linked to any particular causative agent, cure, or preventive actions, Disease X is a stand-in for any emerging infectious disease that could pose a grave threat to public health. This might initially seem nebulous and intimidating, but it's a notion that promotes readiness for the unforeseen. While there's no definitive answer on the exact nature of Disease X, the latest speculations, based on our knowledge of previous and current infectious diseases, suggest that it could be a novel, highly infectious, and potentially lethal virus. As for prevention, recent guidelines emphasize the importance of maintaining good personal hygiene, practicing social distancing, and wearing appropriate personal protective equipment. Moreover, the management strategies for Disease X are also evolving, and currently, they focus on early detection, prompt isolation and treatment of patients, and rigorous contact tracing. Firstly, Disease X could be triggered by a variety of pathogens, as per the latest guidelines. These could encompass viruses, bacteria, fungi, protozoa, or parasites, now also including prions and viroids, all of which are recognized agents behind infectious diseases. Secondly, in line with the latest guidelines, Disease X can be transmitted via a multitude of avenues. These include direct physical contact with an infected individual, exposure to the pathogen in the air, droplet transmission, when the disease travels in tiny droplets after a sneeze or cough, vector-borne transmission, where the disease is spread by insects or other carriers, and also through foodborne and waterborne routes. Additionally, zoonotic routes of transmission, which involve the disease passing from animals to humans, are also potential modes of transmission for Disease X. Third, the symptoms of Disease X have been revised based on the latest guidelines. Factors such as the type and severity of infection, the host's immune system, and the presence of comorbidities continue to influence the symptoms. The updated common symptoms now include persistent high fever, dry cough, loss of taste and smell, extreme fatigue, muscle aches, severe headache, difficulty breathing or shortness of breath, chest pain or pressure, confusion, and bluish lips or face. Please note that gastrointestinal symptoms like nausea and diarrhea, skin rash, and swollen lymph nodes are less common, but are still possible manifestations of Disease X. Regarding prevention, the latest measures could prove fruitful against Disease X. These involve regular and thorough hand hygiene, using sanitizers with at least 60% alcohol or soap and water, consistent mask wearing, especially in indoor and crowded places, maintaining at least 6 feet distance from others, getting the Disease X vaccine and its subsequent booster shots if available, adhering to local guidelines regarding crowd avoidance, equipping oneself with a pulse oximeter to monitor oxygen levels at home, and importantly, seeking immediate medical care if symptoms worsen. In terms of treatment for Disease X, the latest guidelines suggest that targeted or adjunctive therapies might be utilized based on the infection's precise nature and phase, the availability of pharmaceuticals or inoculations, and the patient's reaction. For targeted therapy, one can consider antiviral agents, monoclonal antibodies, or specially designed drug cocktails. On the other hand, adjunctive therapies now include advanced therapy, oxygen therapy with pulse oximetry, smart pain management strategies, and personalized nutritional support. Finally, managing Disease X will likely involve implementing public health interventions as per the latest guidelines. These include enhanced surveillance, comprehensive testing, meticulous tracing, effective isolation, strict quarantine, rigorous contact tracing, and a robust outbreak response. In summary, Disease X highlights the significance of readiness in dealing with any potential infectious disease that could surface down the line. With the latest guidelines on Disease X, it becomes more vital than ever to invest in research and development, particularly in the creation of vaccines, diagnostic tests, and treatments. These measures are pivotal in battling both existing and potential pathogens. Echoing the World Health Organization's "the best preparedness for future pandemics is readiness." Therefore, while the nature of Disease X continues to be elusive, our proactive and informed response to it, based on the latest guidelines, does not need to be.